Now, in the thick of the COVID-19 pandemic, a lung specialist wants to give her patients on ventilators some better information as they fought for their breath and their lives. The doctor couldn't find the written material she was looking for, so she wrote the book herself. Dr. Milan Han is that doctor, and her book is titled Breathing Lessons, A Doctor's Guide. It warns us that a tidal wave of lung disease is coming, and we're not prepared. Here's some key facts Dr. Han shares in her book. With 5 million people worldwide already dead from COVID-19, 11 million Americans have long-haul COVID. It's among 30% of COVID survivors have persistent lung damage. 70% of those who've had to use a ventilator in a hospital have lungs that are permanently scarred. Meanwhile, very little research is being done to repair the damaged lungs or prevent further lung damage. Dr. Milan Han is joining us now. She's a professor of medicine and chief of pulmonary and critical care at the University of Michigan. Dr. Han is also national spokesperson for the American Lung Association. You mentioned 11 million Americans are COVID long haulers. Is that how much of that group is Black? And what is the reason for Black people being a significant portion of the long haulers?
You know, Naira, when we look at the prevalence of Blacks in our general community, and then we look at the risk for long haul COVID, we're definitely seeing the CDC just put a report out that being Black is a risk factor for long haul COVID. One of the other scary things for me is that we also know that Black individuals are more likely to get severe infections, which is probably contributing to that. They're also more likely to be rehospitalized after discharge from COVID and less likely to get appropriate care after discharge from the hospital. So we have quite a few, I think, really systemic issues when it comes to care for COVID patients and post-COVID care that really need to be addressed. And one of the fears that I have is that the Biden bill, for instance, this proposal for $30 billion in funding really fails to address the reason why we have so many people dying. I have heard no mention of money earmarked to understand why lungs fail, how to support lung failure, and how to help patients who are trying to recover.
Is that disproportionate number of people suffering who are Black, is that due to the medical care they're receiving and systemic racism and challenges there, or is it due to underlying conditions, again, because of systemic racism on the front end?
Nair, this is such an important point, and I think it spans everything you just mentioned. So on the front end, we know that minority groups are more likely to be lower socioeconomic status, more likely to be essential workers, more likely to live in areas where infection rates are high. These are all going to contribute to more infections. But we also know, because of pre-existing health disparities, more likely to have chronic health conditions like heart disease, lung disease, diabetes, that are going to put individuals at increased risk for severe disease. And then there's even additional data, for instance, that came out of the University of Michigan from some of my colleagues, that even some of the tools we use in the hospital, pulse oximeters, were found during the pandemic to not be as accurate among individuals with darker skin, falsely elevating the levels. So doctors may not have even been aware as to how sick patients were. So I think that it's really a systemic problem from being at greater risk before to potentially care possibly during the hospitalization. And then even, like I just mentioned, getting appropriate follow-up care. We have systemic issues with access to high quality care that really spans the gamut.
How do you know you have long-haul COVID? Because so many of the symptoms we hear, shortness of breath, brain fog, can be associated with a host of other medical conditions.
This is something that we as physicians and scientists are really trying to sort out right now. Some patients who, particularly those who've been in the hospital on the ventilator, really do have severe lung scarring. Some are actually even going to need lung transplants. On the other end, we have patients who just have some inflammation that's going to take some time to resolve. And then even another sort of confusing bucket of patients where we can't exactly figure out what's going on at all. The testing sort of is coming up negative. But it's really, really important for patients after they've been discharged from the hospital or after they've recovered to get back into your regular doctor, or if you don't have one, to get one, to really get reassessed and figure out, where are things at? Are you recovered? Is there permanent damage? And what can you do about it?
Any specific tests that should be asked for? Because, you can go to a primary care physician and say all of the things that we just mentioned, and they may not instantly think long haul COVID.
I'm so glad you're highlighting this issue. So there's really two things I think about. One, you can ask for a test of lung function. It's called spirometry. It's really easy. It's available everywhere. And we as physicians do not order it enough. If you want to know if your lungs are functioning properly, you ask for spirometry. And this really applies not just to long haul COVID. We have a severe problem with underdiagnosis of lung disease even before the pandemic. So that's the first thing. And then the second thing is if the spirometry shows up normal and you're still having symptoms, you can ask for more advanced testing like a CAT scan of your lungs. And that's where we can really see more subtle evidence of inflammation or scarring, particularly from COVID. So those are really two of the biggest and most important tests that I as a lung doctor use to try to figure out what's going on with the patient after COVID.
Dr. Mei-Lan Han with some practical advice of how you can find out about your lung condition and if you're suffering from long-haul COVID. She's a professor of medicine and chief of pulmonary and critical care at the University of Michigan. Thank you, doctor.